Greetings, everyone. My name is Megan Franzen, and I am here at Patients Medical in Midtown, New York City, in Manhattan. And I'm here with Dr. Vivian, DeNise, and Chef Elisa Haggarty, and we are here to chat about adrenal fatigue and how you can balance it naturally. But first, let me tell you a little bit about Patients Medical, who we are and what we do here. We are a full-service, holistic medical center right in Midtown Manhattan. So what does that mean? We have all the diagnostics and treatment capacities that you'll need for most of the minor and sometimes major imbalances that most patients are experiencing. We have a multi-specialty center, which means that we have many different doctors and practitioners, and I'll talk to you more about that in a moment. But we have the capacity to do diagnostics, including extensive blood work, many different types of blood work, and other types of diagnostics, including bone density, sonography, and several other things as well. Our motto for Patients Medical is Discover Health, Rediscover Vitality. So what does that mean? We've found that many people are walking around today feeling miserable. And today, particularly, it is a kind of cold, wet, rainy day in the city, and I think many people feel miserable just because of the weather, but even when it's beautiful outside, people wake up feeling either very tired or depressed, not very inspired about what they're going to be doing that day. They may even feel sick to their stomachs or not hungry or maybe ravenously hungry, but just really unbalanced even upon waking. And then going throughout their day being unsure about what to eat or just filling their bodies with sugar and coffee or soda, many things like fatty foods that don't make you feel good, but you don't know what else to choose. And then you feel like taking a nap by mid-afternoon. And then when you're finally finished with work, possibly you feel like so exhausted that you can't even do anything but go home and just flop down on the couch and watch TV for the rest of the night. Well, our patients have found that when they come here, they see the doctors, and even after just a few minor tweaks to their health, they wake up in the morning feeling inspired and awake, excited about their life. They feel like they can go throughout their day making healthy choices, eating healthy food, choosing it quite easily, not needing to depend on sugar or caffeine to get through the day, and then having plenty of energy after work to make themselves a healthy meal or go to the gym or spend some really good quality time with their friends or loved ones, and their life is completely changed, all from just a few minor tweaks to either the diet or lifestyle, maybe balancing their hormones. And that's why we say that we help people rediscover their vitality when they're able to discover their true health. And the doctors do this by focusing on the root cause of a symptom. So as opposed to a more conventional medical paradigm where you go to the doctor and you tell the doctor about your symptoms, and then the doctor gives you a prescription and says, all right, come back if this does not work, and we'll figure out something else. Our doctors here would rather figure out why the symptom is happening. So that means doing the diagnostics and using the symptom as a roadmap to figure out what is actually going on in the body, what is causing the body to give you the symptom, which is kind of like a distress symbol. So if you cover up the symptom, then you might not know exactly what's happening in the body until your body gives you an even stronger symptom, which of course we're trying to avoid, right? So we integrate modern medicine, holistic practices, and natural supplements, and many other treatment protocols to create true health in your body, mind, and your spirit. Our goal is to promote healing and actually prevent disease, which is a novel approach in this day and age where we all are so used to feeling sick and then running to the doctor. We prefer that you run to the doctor so that you don't have to feel sick. It's much easier for everybody that way. Our physicians collaborate to approach each patient holistically. So that means instead of going to one doctor's office for one specialty another doctor's office for another specialty, going to a third doctor's office for a different part of your body, and none of them really agreeing on what type of treatment protocol that you should be using, or giving you several different ones that kind of conflict. Our doctors are going to get together, and if you are seeing different specialists here, they all will compare notes and figure out what is the best treatment protocol overall for your entire health. It's much easier. That way you don't have to cart around your diagnostics results from doctor's office to doctor's office, but also you don't have to be stressed out by all these different conflicting theories about what would be the best treatment protocol for you and your health. The result is to gain health and nutritional wisdom that can be applied for years to come, and that's not just for you, that's for your children, your spouse, your friends, your family, and it's so much more fun to feel well when all the people around you are feeling well as well. Our founder is Dr. Warren Levin. He began practicing his groundbreaking holistic protocols in 1974, and these protocols were created, if you can believe it, even longer before that. So these protocols that we're going to be talking about here today are tried and true. They're not something that we just came up with recently. They're something that has been in practice for many, many years successfully. The conditions we treat here at Patients Medical are many. This is just a short list: chronic fatigue syndrome, multiple sclerosis, osteoarthritis, rheumatoid arthritis, diabetes, heart disease, Crohn's disease, IBS, IBD, Alzheimer's disease, Lyme disease, thyroid disease, autoimmune diseases, and the list goes on and on. Our staff include medical doctors that practice internal medicine, family practice, gynecology, osteopathy, oncology, alternative pain management, pediatrics. We now also have an ophthalmologist on staff. We have nutrition, kinesiology, reflexology and Reiki, oriental medicine and acupuncture, homeopathy, and the list goes on. So I believe that here at Patients Medical we have the true meaning of integrative medicine, integrating the holistic medical paradigms that have been used for years and years in traditional and indigenous medical paradigms, and integrating them with the best of Western medicine's cutting-edge, state-of-the-art diagnostics to create a true wellness for you and your entire family. So now I'd like to tell you a little bit about our speakers here with us today. Dr. Vivian DeNise. She's an integrative internal medicine doctor and holistic pediatrician. She completed her medical degree at New York College of Osteopathic Medicine, and she's certified in integrative medicine with the American Academy of Anti-Aging Medicine. And she has a fellowship with them and also certification through them as well. Specialties include balancing the adrenal functions of your body, detoxification, hormonal imbalances, nutritional deficiencies, thyroid disorders, weight loss, gastrointestinal problems, women's and men's wellness, pediatrics, and many, many other things. These, again, is a very short list of the different things that she treats for her patients. And then I'd also like to introduce to you Elisa Haggarty of Culinary Pharmacy. We're excited that she's here with us today as well. She is a certified holistic health coach and natural food chef. She received professional holistic health coaching training at the Institute for Integrative Nutrition and also training at the Natural Gourmet Institute. Elisa has studied over 100 different dietary theories, which is quite a few, maybe even more than that. And she uses food, stress management, and many other techniques to help women and men as well live an abundantly rich life. So let's talk about how we can beat adrenal fatigue naturally, safely, and effectively. And Dr. DeNise, we're going to start with you this morning and give us a little bit of insight into this energy crisis. But we're not talking about gas or petrol, right? We're actually talking about something completely different. What are we talking about with that?
You know, Megan, most people, it's the most common complaint that brings people into the doctor's offices today. And usually they leave feeling hopeless and helpless. Sometimes they come back time after time, and they still leave with feeling as exhausted as they came in.
Wow. And, I've heard people, when they call in on the phone, they say, I feel tired all the time.
Right.
Have you found that in your practice?
Exhausted. And that, it not only affects your work, which, not many people could afford to be tired at work these days, but it affects your family. It affects your health.
Devastating, actually.
And most people don't even know why they started to feel, when they started to feel so tired, where to start, how to start feeling better. They try to take sleeping pills. Oh, I just need to sleep more. So they take sleeping pills, and then they go to the doctor for sleeping pills, and then, well, maybe you're just depressed. And it really starts at catch-22. And, of course, at Patient Medical, our philosophy is getting to the root of fatigue. And I hope by the end of today everybody's going to realize fatigue is a lot more than just not sleeping well.
So it's actually caused by other factors that maybe have yet to be diagnosed.
Absolutely.
So this is a kind of fun little graphic here. So the symptom is actually just what we see at the top. It's kind of like the iceberg, parallel as well, exactly. Right? We just see the leaves at the top, but underground.
You just know you're tired, but you don't know why. And there's so many reasons that you could be tired. But most traditional doctors don't even know. They don't even know where to begin.
They don't even realize there are any roots at all.
Right. So I think we're going to show you how you can restore your body and your life.
And wouldn't it be great if we could just plug in, right?
It's not that simple, but it's not that difficult either.
Oh, it can be easy. So suffering from adrenal fatigue. Yeah, sometimes people don't even know what the symptoms are. They don't even realize that they're in trouble until something significant happens in their health.
Right. So drowsiness just means like you're feeling the need to sleep. It could be a rainy day. It could be maybe you didn't sleep as well the night before. But drowsiness isn't what we're talking about. We're talking about absolute exhaustion. So fatigue can be a lack of energy and motivation, and it could be for many things. It could be in response to too much physical exertion, too much emotional stress, lack of sleep, all of the above, none of the above, and a mixture of everything in between.
Boredom could even be a cause, huh?
Yep.
Well, if you're not feeling inspired in your life, you could feel fatigued.
So fatigue could either be a single symptom or a cluster of symptoms such as chronic fatigue or adrenal insufficiency or even cancer.
But we don't need to jump to the conclusion. If you're fatigued, it doesn't necessarily mean that you have cancer.
Oh, absolutely not.
It's just one symptom.
Right. And symptoms can be divided into 3 categories. Which of the symptoms you have will depend on where your body's functions have been compromised and the general area of susceptibility. Some of them may have been inherited or even acquired. And these are just some of the physical symptoms. You may not be able to get through your workout like you used to. You may be feeling achy or you have a pain here and there. So you say, okay, I'm going to go to sleep, and then you still wake up tired. And you feel like you didn't even sleep.
That's the worst, in my opinion, right?
Cognitive symptoms, we know is brain fog. You can't get through the day like you used to. You walk into a room, you forgot why you were walking in there. You can't remember certain words. You have mind chatter. And what mind chatter is your brain is like, you're doing one thing and your brain is thinking about something else. And then mind chatter can happen even when you're sleeping. And this is probably one of the more apparent things. You feel depressed, you feel overwhelmed, everything seems to be an effort. What used to bring you joy, either people or situations, no longer do. And your loved ones and your coworkers start getting to feel like, oh, that person's just lazy or unmotivated, when it's the furthest thing from the truth. These people who are truly adrenally fatigued are exhausted just trying to get through their day. They're doing everything they can to get through their day.
Yeah, I like the term aversion to effort. It seems kind of funny, but that's kind of what it's all about. These people really need help.
Right. So these causes can all overlap. And that's why you really need an integrative doctor, kind of to untangle the whole situation. And I think you'll see on the next slide, these are just the causes of fatigue. It could be environmental, occupational, and we're going to be going into each one. But, you know, it could be you have high blood pressure and you're taking a medication for high blood pressure. So your high blood pressure is causing you to be fatigued. You're on medication that's causing you, for your high blood pressure, that's causing you to be fatigued. Maybe you're so tired you're not eating well. So it's all overlapped and intertangled. Neurologic diseases, this can be Parkinson's, Alzheimer's, epilepsy, multiple sclerosis. Rheumatology diseases could be rheumatoid arthritis. And what's interesting is we're seeing a lot of hypoglycemia in the adolescent and the young adult population.
You're on a sugar roller coaster, huh?
Yeah. So fatigue, for anybody who doesn't understand what oxidative stress is, chemical reactions occur in each and every cell. When there's free radicals are produced from that. And when there's more free radicals than antioxidants, your cells become, and your body becomes under oxidative stress.
And oxidation is a huge buzzword now, antioxidants, trying to get as many antioxidants as you can from your food or your supplements or something like that. So
right.
It's really kind of on a lot of people's minds.
Some of the examples are like CoQ10, vitamin C. You know, it's important to drink a lot of clear, clean water. And these are some of the...
I was just saying, I like those little kind of mean-looking guys, those infections.
And what's interesting is in this past December 2012, the Mayo Clinic came out with an article saying that chronic fatigue syndrome and fibromyalgia is sorely undiagnosed in men and in the young adult population. So you see chronic fatigue is, the theory behind chronic fatigue is that it's an activation of the immune system that causes an increase of inflammatory mediators, which then decrease the amount of ATP, which is your energy source from every cell. And as a matter of fact, in January 2009, they found actually that people who suffered childhood trauma was 6 times more likely to have chronic fatigue syndrome. So it goes all the way back. It's not only the here and the now, it's where you're coming from as well.
Interesting. And I have a quick question. So all of these things, you know, I remember when I was in high school, I was a senior in high school, and I had mono. So I had all of those things, the sore throat, the, you know, unrefreshing sleep, the fatigue, the tender glands, everything like that. Is there any link between mono and fatigue?
Sure. Mono is one of the causes of fatigue. And then sometimes it leads into, if it's not addressed properly, you know, when I deal with adolescents or children having mono, you know, it's how soon can I get back to school? How soon can I'm missing a lot of schoolwork. I want to get back to my games. And they don't allow their bodies to heal properly. And if you don't eat properly, it's kind of like you're never catching up.
Mm-hmm. Mm-hmm. Very important to address it at the time that it happens.
And this is kind of a fascinating topic, and I won't get into it too much, but the imbalance of the neurotransmitters and the cortisol deficiency is one of the big causes of chronic fatigue. For example, a decreased dopamine, which is a neurotransmitter, has been associated with addictions and cravings. So if you're craving sugar, it causes you to go high and then go low. Imbalances in norepinephrine causes lack of mood, energy, focusing, and that's usually when your adrenal glands are under attack.
Mm.
Fibromyalgia is defined as chronic diffuse pain. You usually need 11 of 18 tender points to be diagnosed, in addition to other symptoms. And I think in a couple of slides we'll be seeing. And there we are. And what's interesting is visual disturbances are extremely common in fibromyalgia. So if all of a sudden you're having aches and pains, and then you're having visual problems, it's a good place to start.
Get checked right away.
Yep.
Stress. None of us have any stress. Well, maybe just a little bit.
Just here and there. So what's interesting is people who are overworking or are working shift work have an increase in fibromyalgia, chronic fatigue, adrenal insufficiency. It's kind of all like if you remember those Venn diagrams from school, it's kind of all intermixed and they kind of blend into one another. But shift work has been known to decrease serotonin, which leads one to be stressed and fatigued.
Insomnia, that seems like which came first, the chicken or the egg, right? Do you have fatigue first or insomnia?
And it's interesting, but what's interesting about this slide is 40% of all children and adolescents are exhausted, and they're responsible for half the accidents of children or people falling asleep at the wheel.
Wow.
So not only do we have inexperienced drivers, we have exhausted drivers.
Mm. Exhausted teenage drivers.
Right.
No.
And I know Chef Lisa is going to speak most about this, but of course avoiding carbohydrates right before bed is a big help to help with insomnia.
And people don't really, they don't know about that, I think. I think a lot of people are having snacks right before they go to bed, or I remember my mom, she always used to have graham crackers and milk right before bed.
Well, the milk is probably good for the serotonin.
But yeah, people eating, just really making not wise choices if they are having these issues.
What would you suggest?
Like
before bed?
Probably just like a warm tea. Because again, it comes down to people having cravings. It might just be more hydration, like we mentioned this once before. So probably just drinking like a warm tea, obviously non-caffeinated would be best, just to kind of relax and mellow out.
Great idea.
And so insomnia doesn't only just leave you exhausted. You can't think as well. You can't concentrate as well. You're essentially sleep deprived. By sleeping 1 hour less a night, by the end of the week, you have not slept an entire night.
That's a lot.
Yeah, who can concentrate or do a job well if they haven't slept?
Yeah. Well, and I know a lot of, parents in general, especially parents of younger children who are chronically sleep deprived, and they're having problems in the bedroom as well. Mm-hmm. They feel like everything is crashing down on them, but maybe just, trying to focus on getting their self balanced so they can have the sleep they need, they'll feel a little bit more like warming up to their spouse.
More in the mood.
Mm-hmm.
And this is interesting because I really feel that our children are stressed beyond belief. they're in 3 or 4 sports. They're attending religious education. Because of all the testing, especially in New York State, the requirements for school are so much more. And I feel that the children just have no downtime.
It's true. Really long school days.
Yeah.
They come home and they're doing homework as well. I mean, it's like a non-stop cycle.
Mm-hmm.
And then they're on the Wii or the Xbox all night, or
texting.
Texting. Yes, another pet peeve.
Chemical stress.
We've talked so much about the BCPs and the PCPs and the heavy metals, but what this is all doing, like the mercury for adrenal glands, are extremely toxic. Mercury just attaches to the adrenal glands more than probably any place else. And the adrenal glands put out, which we'll get into later, cortisol and epinephrine and norepinephrine, and things you really need to feel well and balance the rest of your body.
Mm-hmm. And I'm just going to put a quick plug in for our detox webinar that you can also find on the resources page of the patient's medical website. If you know that you have toxic levels of heavy metals, or if you haven't done a detox in a while or ever, please listen to that webinar. That'll be a good start in the right direction for you.
We'll to be having another seminar.
Yeah.
So these are sources of mercury, which, everybody knows about the shellfish and the dental amalgams. But what you may not know is it's in cosmetics, it's in floor wax, it's in floor polish, it's in paints, it's in tattoos. Tattoos are a big thing now, but a lot of people are using mercury in the paints of the tattoos.
Yeah, so pretty soon they should put something on the market, organic tattoos, right?
Yeah.
That'll be the next big thing.
You heard it here first.
Wait, I shouldn't have said that.
This is so important, and I really feel that a lot of parents these days are trying to do the right thing, so they buy low sugar and sweetened with aspartame. But aspartame converts to methanol, which is really a major. Methanol breaks down to formaldehyde in the body.
Not better than sugar.
Right, and it goes
No,
into the brain. And even the FDA reports this as being one of the biggest food sensitivities.
And it's tricky too, because as a parent, you can actually be in the store and it'll look like a healthy food and it says no sugar or unsweetened or something like that. And then it'll actually have one of these products in it. And it's very tricky. You have to be you have to be a food detective. You have to really look at what's in your ingredients.
You do, because, like one of the things I look for mostly when I go shopping is if it says sugar-free or no sugar, I actually, that's a red flag for me. Mm. And I always tell my clients that you have to read the back of the label, the ingredients. If you can't pronounce it, don't eat it. If you don't know what tree it came from, don't eat it. Simple concepts that we can all live by. Mm-hmm. But aspartame and Splenda and all these things and sucralose, they're in so many supplement companies too. Mm-hmm. A lot of my friends are on board with a lot of, health coaches out there, and fitness gurus are out there with all these, health supplement companies, and they're all using sucralose and aspartame in their protein powders, in their, granola bars and things of that nature. And I'm just like, we've got to stop this. So it's even in these health foods that most people just would never know. So it's really criminal.
Tricky.
And these are just some of the effects. All of a sudden, you're numb, or you're having muscle spasms, or you're gaining weight and you have no idea why. Most people don't realize that when they eat something with aspartame, yes, the calories may be 0, but it's telling your body you're hungry. Mm-hmm. So it's actually, what you're drinking may be no calories, but it's causing you to eat more. So it could cause headaches, migraines, dizziness, even seizures in some children.
Horrible.
And of course, we all know about the vitamin deficiencies, iron and B12. But what you don't see is the tingling of extremities. You may just have something simple as mood swings. One minute you're happy, the next minute you're sad, and you have no idea why. B5 is extremely important, but just as I don't want anybody who's listening to this just to run out and get B5 and just assume, well, I could just get one B vitamin. It's really, if you take one B vitamin, you upset the rest of your B vitamins. So you always want to take a multi-B complex.
And actually, before you take any vitamins at all, you should probably check with your holistic doctor to find out whether you actually need them or if they're the type that you need or not.
Right. But look how interesting. One of the causes of a B5 deficiency is synthetic estrogen, which is like birth control pills or synthetic hormonal replacement. We're not talking about bioidentical hormone replacement, but we're talking about synthetic or sleeping pills.
I would say that of the women in America, how many do you think are on either caffeine or synthetic estrogen or sleeping pills?
And they, or but all of the above. I have 13-year-olds who are on it for their skin, birth control. Mm. So how much can they concentrate in school? Mm. And we'll leave this to Chef Elisa, but these are just some of the natural sources you can get B5 from. The adrenal glands are the second biggest warehouse of vitamin C. So everybody thinks, oh, well, we need antioxidants, so I need my vitamin C. But you need it because you need to supply your adrenal glands so they can do their job. Mm. And this is what we were talking about in the very beginning of the presentation. Statin drugs, which lower your cholesterol, deplete CoQ10, which is a powerful antioxidant. Again, oral contraceptives. Anti-diabetics can deplete certain things in your body. So you have to also know what you're taking. Not to say don't take them, because here we do practice integrated medicine, which means we practice the best of both worlds. And it's not that we don't believe in medications. Certainly sometimes you do need medications, but you just have to know how to balance what you're taking. And who doesn't have emotional stress these days? Our relationships seem to be more transient. They're lacking commitment. We're worrying about the economy. Everything seems to be a major effort. There are 30 million Americans on antidepressants. That's 1 in 10.
Wow, that's a lot of depressed Americans. All right, look at these guys. What are they? They're our little adrenal glands.
So adrenal fatigue occurs when the amount of stress oversees the capacity of the body to compensate and recover from that stress. And actually, you had talked about one of your first slides about when Patients Medical was founded, but adrenal fatigue was actually first discussed in 1936.
Wow.
It's been in the medical literature. And actually, it was a very acceptable disease and very, practiced by traditional doctors, and then it kind of fell out of use.
Interesting.
But it's well known in the literature.
Wow. Well, so let's figure out actually where these guys are, because I'm sure a lot of people don't even know where their adrenal glands are. Are they in your throat? Are they in your leg? Who knows? We're about to find out.
So they're two little walnut-shaped glands that sit on top of the kidney. They're not attached to the kidney. They're just sitting on top of the kidney. Sometimes it's thought of as the forgotten glands. They respond to every kind of stress in the same way, whatever the source. And you know what, Megan? This could be good stress. It could be bad stress. you may really love your job and you may be like loving what you do, but it's still stressful if you're not getting the proper amount of sleep a day. Right. You may be exercising and you love to run, but you may be overstressing your body.
Mm-hmm. So this is the true essence of everything in moderation, right? Anything of too much, even a good thing, might be maxing out your adrenal glands.
So the adrenal glands are in two parts. The outer part is called the cortex, and the middle part is called the medulla. And during a crisis, they all work together. They dilate your bronchi, your breathing tubes. They make your heart beat faster, bringing more oxygen and blood to your tissues. It's more of a fight or flight response. And this is the adrenal cortex. The zona reticularis is the center part. They make DHEA and DHEAS, which is, once you hit menopause, that's responsible for most of your sex hormones. The zona fasciculata is the blue part that makes cortisol, which is going to affect your sugar metabolism, your thyroid, your fat metabolism. And the zona glomerulosa produces aldosterone, which regulates your fluid balance, your water regulation. And what this shows is that it's a negative feedback, meaning as our cortisol, let's say you're under stress and your adrenal glands are really pumping out cortisol, it's going to tell your hypothalamus, okay, we have enough, which is going to decrease your cortisol releasing hormone, which is going to decrease your adrenal corticotrophic releasing hormone, and eventually you're not going to make as much cortisol as you used to. Mm-hmm. So then your sugar becomes out of balance, your thyroid becomes out of balance, your fat metabolism becomes out of balance, you start gaining weight, and it sets up, a nightmare. And this is what we were just talking about. Adrenal fatigue can evolve over months to even years, and some babies are even thought to be born adrenally fatigued.
Born with adrenal fatigue.
Because the mothers, if they're adrenally fatigued when they get pregnant, the baby will make cortisol to make up for the mother's lack of cortisol, and then when the baby's born, the baby loses the cortisol and is exhausted already from the start.
That's amazing. Definitely, pregnant women, rest up. don't stress out, please.
So here are just some of the symptoms. You may have anxiety, increased fear, depression. You may have less tolerance, more irritability. And what's interesting, it's not uncommon for people to have muscle weakness and low back pain, or knee pain, or foot or ankle pain, or pain of the calves. So people may think, oh, I got injured, I hurt myself, I don't know, it must be an old football injury, and it's really just signs of your adrenals needing help.
How many people are walking around saying that, right? It's an old injury.
Right.
But it checks.
So this is how we diagnose this. First, we take a very careful history, and like we just discussed, we go back to birth, and maybe even before that. We ask about your family history. We do blood tests and we do saliva tests for cortisol.
So this isn't something that we just have a patient walks in and says, Doc, I'm so tired. I feel like I have chronic fatigue. And you say, here you go. Here's what I recommend. You really want to figure out what biochemically is going on in the body.
Right. And these are just some of the patterns. Like there are many different phases of adrenal fatigue. You may be too high. You may be too low.
And exactly what are we looking at here? The
red line representing the cortisol patterns. Your cortisol puts out 4 times a day. And it's usually, when your cortisol peaks, that's when you open your eyes in the morning. It's when your melatonin drops and your cortisol peaks. And then as you go through your day, your cortisol slowly drops to the point where it's the lowest point, which is when you fall asleep. But if you see, sometimes if your cortisol stays high, you can't fall asleep because it's balancing your melatonin, which is your sleep hormone.
Interesting.
This is a very common pattern, probably the most common we see. It's where the patient wakes up exhausted. They wake up, they slept or haven't slept, or they feel like they haven't slept. They drag themselves out of bed. By noon to like 2, 3 o'clock, they're reaching for the sugar, the caffeine. By 6 o'clock, they're on their second wind. They feel great. They feel like they should have felt in the morning. As a matter of fact, they're wondering why they can't feel this way in the morning. And then it starts a vicious cycle because now they're wide awake and it's time to go to sleep. So here, this is just some of the treatments, but just as important as anything else, meditation, yoga, prayer, whatever is stress relieving for the patient. And mild to moderate exercise. We don't see, most people will feel, I feel much better after I exercise. And that's true. That's because they put out a lot of their serotonin and they cause their adrenal glands to go into overdrive. So for a very short time, they feel great when they come home from the gym. And then they're exhausted. Mm-hmm. So of course we want you to exercise, but we want it to be mild to moderate, not a lot of heavy aerobics.
Interesting. And, if you're not into meditation or yoga or prayer, if you feel like that's a little bit too woo-woo for you, you can take a walk around the block at lunchtime. You can just sit on a park bench and stare into space, something where you can just kind of disconnect and let go a little bit.
And these are just some supplements, but like you said, Megan, you just don't want to go to your local vitamin store and pick one of everything, because these are all good. You want to know what exactly you need. What is your vitamin C level? What is your B6 level? Do you need CoQ10? Do you need more CoQ10? Are you on a statin drug requiring you to need more CoQ10 than the average person? So you really need to be with somebody who's very well versed in what to take and what you're taking and put it all together for you.
And making sure they're not interacting with any of, if you're on a pharmaceutical or something like that, making sure none of the supplements you're taking are interacting with those things. All right, great. Well, so that's amazing. So we established that there are so many people who are chronically fatigued out there for a bunch of different reasons. There's a lot of really cool supplements, but if you're already taking supplements and you want to do something else, or even just basically, where we all start is the food, right? We all eat food every day. So why not support ourselves with really great healthy foods that can support our adrenal health? And so Elisa Haggarty is going to tell us about that. So Elisa, please tell us a little bit about who you are, what you do, and why you do it, and what you recommend here.
Thank you. Sure. My philosophy is using food as medicine, and it's an age-old philosophy that I've been able to effectively help and treat a lot of people with over the years. And it's one that can actually be enjoyable and delicious. A lot of people tend to think that when they have to go healthy, they start to think of deprivation and eating what we call bird food and everything like that, and boring foods and just salads.
Nuts and twigs.
Yeah, that's what they think. People look at me and they feel bad for me. They think I don't eat well. They think I don't eat different foods and have variety in my diet, but that couldn't be further from the truth. And that's what I try to teach my clients, is that you can make food joyful, fun, and creative, and very healing too. So.
And I've tasted some of your creations. Believe me, you eat well.
Yeah. So my journey with health just briefly started from a space of not being healthy, from a space of being depressed and overly anxious. And I was given a prescription by the Western medical community to pretty much take antidepressants. And this was about 6 years ago. And I didn't really know much at that time, and depression and anxiety ran in my family, so I figured, okay, let's do this, because I was nervous. I was scared about this feeling every day of feeling not only tired and fatigued, but just not feeling happy anymore at all. So I took the medications for about a year, and I realized that they were sort of they were a Band-Aid, to the problem. They didn't really address the root cause of what was going on for me. So I spent many years after that studying the relationship between food and healing, between what effect my breakfast had on my energy and what effect my breakfast had on my mood. So I found it was a lot of trial and error for me, but I was able to basically create my own healing path. And I always encourage people to find out what works for them. It doesn't have to be, there's over 1,500 diet books in Barnes & Noble right now, and that's a low estimate. But it's important that you work with an integrative medicine doctor or a health coach to figure out which diet works best for you, because your body is unique. And unfortunately, during that time in my life when I was depressed and anxious, I wasn't being given a personal prescription. I was being given a, pretty much a staple Band-Aid approach to happiness, and it simply didn't work. So
very rarely does a Band-Aid work for happiness.
Right? It doesn't work, yeah. So in my practice, I do a lot of individual health coaching programs, which most people really benefit from, because it's one thing to know what to do, to know how to eat, to know what supplements to take, but it's another thing to have that accountability week in and week out to stick with the diet, whether it be beating candida, reversing diabetes, things of this nature. There's that sense of accountability that people really benefit from. I do some 4-week sugar boot camps, which are really fun. That's online based. I do a lot of cooking demos, and even I have a winter detox, which is actually really rejuvenating. And the ingredients for my success are, I use basically whole foods cooking, local, seasonal, fresh, plant-based, cleansing, and even I use mindset shifts. I just got off the phone this morning with a woman in Hong Kong. We were doing a consultation, and it was more about, did she believe that she could heal? And if you don't believe you can heal, and if you don't believe you have the power to get your life back in order, then it's going to be a longer road. So mindset shifts are a huge component of what I do in my practice, too.
It's so helpful, too, especially for people who've been feeling badly for a very long time, to have that kind of support to help them, even get them started.
Yeah.
Sometimes you're given some directions by your doctor, or, a set of recommendations that say don't eat any of these foods, but you don't know what to eat or how to incorporate or how to shop or how to snack or anything like that. So just to really complete the process, there's nothing like the support.
Yeah. It's definitely overwhelming to get to be diagnosed with one or two things. And oftentimes, like you're saying, Dr. DeNise, people come to us with many different things. It's never just adrenal fatigue. It's always linked to the thyroid. It could be linked to a weak liver, because the adrenals power the liver, they power the kidneys, they power everything in the body. So it's all interconnected, and oftentimes it can be really debilitating, but there's always a pathway. So we've mentioned this a lot, that food has an amazing capacity to heal. It can promote sickness or it can promote health, and it's really our choice. And again, like I said, there's over 1,500 diet books in Barnes & Noble, but finding and working with somebody to get your personal treatment plan is really the best recommendation I can give, because iodine might be great for you, but it's not going to be great for somebody with Hashimoto's perhaps. So we have to be very mindful of where we're bringing in nutrients and how much. And so the most essential part, I love this topic, adrenal health, because I have a lot of experience with having weak adrenals off and on over the years, because I work too hard or I work out too much or whatever it is. So this is something I'm familiar with, but the most important component to any health remedy, whether it be fibromyalgia, MS, rheumatoid arthritis, cancer, is simply to restore energy and vitality. And I was listening to a talk yesterday by Dr. Mark Hyman, and he was saying that in the Western medical community, people focus so much on the one problem, and they don't just focus on restoring health and vitality. There's people out there maybe with a debilitating disease like dementia or Alzheimer's, and there's not a clear-cut pathway to health for that. But we know we can restore energy, we can balance blood sugar, we can work on replenishing the adrenals, we can work on toxicity. So these are all components of just overall general health, which ultimately take care of, the small or the rather big debilitating concerns that we have. So
it's the whole roots thing again, right?
Yeah.
You take care of the roots.
You do. You address everything. And so I always ask people, what do you choose? And a lot of times when I consult with people, I ask them in the very beginning, paint me your ideal day in health. What does it look like for you to wake up from morning to night? What does it look like in terms of energy, food, relationships, productivity? And for a lot of people, they can't even imagine that. They've been stuck in this phase of sickness and fatigue and mediocrity that when I ask them this question, it's really hard for them to even grasp it. So that's a good thing for you right now if you're listening. Just paint your ideal day in health. What does it look like for you and for your family perhaps? And, you have a choice. And if you can surround yourself with the right team, you're going to be setting yourself up for success.
That's so key, having a wellness team or even just a team of supportive people around you, even if they're not health or wellness or medical people. People who can say, yeah, you can do it, or, yeah, let's go and get a healthy meal or a cup of tea instead of a gin and tonic or something.
Adrenal villains, some of the things that I look at right away in my practice, and I have to say that although food is my topic today, and one of the biggest things with adrenal health is lifestyle. You can't address the diet without lifestyle. So primarily I do discuss lifestyle with people, but when we talk about food, which is a huge component of the healing plan, the villains that really zap our adrenals and zap our overall health, create inflammation, are sugar of all kinds, even our healthy sugars, like maybe coconut palm sugar. Well, someone with candida, someone with adrenal fatigue shouldn't be having a lot of sugars even if they're healthy. So we have to look at balancing that. Consuming foods that you're allergic or sensitive to, and this is a long list actually. Corn, yeast, wheat, gluten, dairy, eggs, soy, alcohol are the top offenders. And if I'm not mistaken, that's a pretty good makeup of what every American generally eats every day.
And I think it's important to look and see soy as being up there as one of the villains. A while back, everybody was on let's eat soy, it's going to decrease breast cancer. And actually, nothing could be further from the truth. It's actually estrogenic, and it acts as an estrogen, sort of. So it gives your body the message of it being that it's being estrogen, and there isn't. So other functions are decreased.
Yeah, that's a really big issue, the soy concept. We could probably have a whole seminar just on soy and how you really need to eat it one way and not the other way. So.
Good idea. Seminar on soy coming soon.
The list is endless. A lot of possibilities. And the other things that are offenders are stimulants, which are coffee and cacao or chocolate, which are what most people live on in America. That 2 or 3 pieces of dark chocolate might seem completely harmless, and in some ways health promoting. We know that there are benefits to cacao. However, it is a stimulant, and what we want to do, the first thing we want to do with adrenal fatigue is to get out of the fight or flight mode. And things that raise cortisol, like our stimulants, are going to promote that fight or flight. So unfortunately, save the chocolate for a time in life where you get replenished and nourished, but not during your adrenal fatigue journey. And then, of course, just refined and processed foods. They are nutrient zappers. And that's pretty much anything, if you're wondering what are those foods, anything in the supermarket that's in like the middle aisle. If it's in a box or a package or a container and has an expiration date 3 years from now, you can be quite sure that it has no nutritional value. Obviously stress and toxic
But even GMO foods.
Yep.
Which zucchini is the biggest GMO food that there is.
Yeah.
And really unhealthy for you.
Yeah, so really being mindful. It's funny because I said something before about the artificial sweeteners, that being, some people think aspartame is healthy because it has 0 calories. Some people think, everyone's making a big fuss about GMOs, but there's no denying that things that are artificially made, chemically changed at the seed level are so different and foreign, and they work they don't work in synergy in our body. They create inflammation, they create harm. So being conscious of not having, zucchini, obviously too much high fructose corn syrup, which is a huge genetically modified crop too. So
to support our government in keeping GMOs labeled and out of organic foods, please.
Well, it's interesting because the U.S. is one of the few countries who allow GMO foods.
We're really behind on many things. I don't know what's going on. I guess we're getting there slowly, but there's so many countries out there who demand it to be labeled. There's some countries that won't even let it in.
Right.
So it's important that we get there as a country. So this is a recipe that you guys have. You can obviously use this as much as you like as maybe your go-to snack or something that's a really great blood sugar regulator and also something that's kind of decadent. Again, I mentioned some people think healthy food is boring, it's tasteless, it's grilled chicken and a Caesar salad. That could be the furthest thing from what I would consider healthy or the truth. So it's good that we can have these little snacks and these energy nuggets to kind of keep us going. So I can just walk through the ingredients, I guess. If you could maybe think the next slide would go through the ingredients. So this is a recipe that's actually pretty simple to make, and I'll go through all the ingredients, but all you really need is just a food processor. And actually, if you didn't have a food processor out there and you don't want to go buy equipment, you actually could just, if you had a little strength in you, you could just make them yourself by just stirring really well.
It could be your exercise.
It could be your exercise. Right? That's a moderate, you know, you could be mindful cooking. You could be thinking of peaceful things when you make these. So that's all part of it.
Should I go back to the recipe?
No, actually it's okay because we do get to some of the ingredients that are most important.
There you go.
So when I look at the food component for people when they come to me, it's really blood sugar success. There's blood sugar success on the plate and off the plate, but now we'll talk about on the plate. So really making sure that we have a balanced snack and a balanced breakfast, lunch, and dinner. And I really use fat, fiber, and protein as some of the best components to balancing a meal. So I'm never going to just have a piece of fruit in the morning. That's a disaster for blood sugar. And especially for people who are pre-diabetic or diabetic, you certainly want to be very mindful of fruit consumption, sticking to berries only, I would say initially, and then making sure that you're pairing it with some sort of fiber, some sort of fat and protein. And that really sort of gives our blood sugar an ability to last longer. You know, a lot of people come to me and say, I have breakfast at 6:30 and I'm starving by 7:30. And I'm like, well, if you're eating Cheerios, of course you're going to be starving by 7:30. There's virtually no nutritional benefit there, and
you should eat the box instead.
The box would be more nutritious and less harmful. I think there was a study about that once that they gave the box to rats or something, and the rats actually fared better than the ones who eat Cheerios, something of that nature. But anyway, yes. So we want to make sure that our meals are balanced. And so in this recipe, which we will go over some of the ingredients, I got a lot of really good fats from tahini, which is really just ground up sesame seeds. That's not, it's really a Mediterranean product, but it's pretty commonly used nowadays with sesame seeds and tahini. It's in your hummus. It's in a lot of snacks. I use it in even smoothies. If I make a chocolate or a carob smoothie, I'll use a little tahini. So,
and they just came out with a new study again telling us that a Mediterranean diet is healthy.
Yeah.
So if you didn't hear it 10 years ago, now you get it again.
Yeah, absolutely. And then coconut oil, which is all the rage these days for a lot of reasons and for good reasons, which I'll explain. There's a lot of healthy medium-chain fatty acids there. And I'm getting fiber in this recipe from a few things, from the hemp seeds, from the flax seeds if you want to add them in, from the nuts themselves, and also from the actual sesame seeds. And the protein that I'm using from this, although you could add a really good high-quality protein powder if you really wanted to bulk this snack up, I do that a lot. I have a couple of protein powders that I do like. You can use the protein here, though, from almonds and cashews to be really sufficient. And, of course, the hemp and the flax seeds do have really high levels of protein and all the amino acids, actually, that we need. So this meal doesn't look like it's high in protein, but actually, if you're using hemp seeds and you're using these ingredients, you're getting all the amino acids that your body would need. Essentially, there's no amino acids here that wouldn't be on a plate with chicken and steak, which a lot of people wouldn't believe, but it's true.
Surprise, surprise.
Yeah. So fat is your friend. Please don't believe the hype that fat is bad or that all saturated fats will lead to coronary heart disease or will give you high cholesterol. It doesn't work like that. So fat doesn't make you fat. I always tell people that sugar is the biggest culprit for inflammation, for weight gain, and for just decline in adrenal health as well. So making sure that we have fats in our food, I mentioned before that sugar-free is a label that gives me a red flag. Whenever something says fat-free, that also gives me a red flag. Now that doesn't mean that I'm going to have 16 tablespoons of coconut oil a day. I use it in moderation and cooking and when I need. But fat is super, super important for every cell and hormone in our body. And interestingly enough, for blood sugar regulation, because that is really the key, I think, for making sure we're satiated between meals, is that we're balanced between meals too, is that fat takes the longest to break down. Carbohydrates break down the quickest, protein second, fastest, if you will, and then the slowest to break down are fats. So the diet for diabetics who are staying away from fat, I know a lot of people who are like just scared of fat. They're just completely scared. They don't want to have it. They don't want to eat it because they have such a bad connotation with it. But those are the people also who struggle with serious blood sugar regulation and diabetes. So really making sure you're getting fat in your meals, natural occurring fats. Plants have fat, seeds have fat. Whole grains have some fats. So
Healthy fats, please.
Yeah, fats from nature. So coconut oil, as we're on this topic, is a medium-chain fatty acid. It has a lot of health-promoting properties. It actually inhibits the growth of yeast or candida, which I think it's estimated that over 80% of our population has high levels of candida or higher levels of candida. Now, candida is something that we always have in our body, but to different degrees. And so, unfortunately, for a lot of us in America, that's present. But it doesn't have to be. And medium-chain fatty acids create heat or thermogenesis in the body. They help boost metabolism and actually help aid the health of the thyroid gland. So it's a really great fat to add in. It's actually rich in lauric acid, and with that, lauric acid is also found in breast milk. So there's a really good correlation and relationship between how similar they are, the fatty acids. And interestingly enough, people are talking all these days about omega-3s and how important they are, and they are so important. But actually, the presence of coconut oil and medium-chain fatty acids actually help the assimilation of our omega-3s. They work in tandem together. So this is a recipe that does include omega-3s, plant-based, and does include some medium-chain fatty acids. So it's a really complete little snack. And then, so Carob is one of the things I used. You know, this if you have this snack, or if you make it at home, or if you've had something similar, you'll know that Carob is very similar to chocolate. It tastes like chocolate, and it's one of my favorite ingredients to use as of late. I've been staying away from cacao for a number of different reasons, even though it's, you know, high in antioxidants, it's a superfood. I don't need stimulants right now in my life. So I've been using Carob. And Carob actually is really high in calcium and magnesium, and it's stimulant-free. And it really gives that sort of chocolatey feel, which is good in the culinary world to keep kids and keep people happy who have that chocolate mix. So.
And I think that people's connotation of Carob depends on where they're from in the world, because I know people who are not from the United States who have very fond memories of consuming Carob, you know, either from a plant in their backyard or from, you know, treats that their grandmother used to make. And we here in America, Carob, it's like a healthy version of chocolate, you know. But I say, if you've never tried Carob, give it a go.
Yeah, it's really good.
It's really delicious.
Yeah, it really is fantastic. And actually, too, like, you know, if you're someone out there who's recovering from adrenal fatigue and you can take a little bit of stimulants, they actually pair well together from a culinary point of view. So if you do have cacao and you add in, maybe just to lessen the level of cacao in the recipe, you can add in some Carob and really meld the two. It actually makes it more of a chocolatey feel, a richer feel. So you can blend the two.
Best of both worlds.
Yeah, you can. Just a note about the Carob, too. For children, I wouldn't generally give them a lot of raw cacao. So I might make chocolates for them in, like, you know, cute little fun, playful molds or something, but I'm going to use Carob because they are going to go crazy with a lot of the stimulants. And plus, we know so many children are already taxed on the adrenals, and the last thing they need is, although healthy, very stimulating chocolates throughout the day. So hemp and flaxseed, these are, you know, you can use both in this recipe or one in particular, hemp if you'd like. Both are very high in omega-3 fatty acids, which we know to be highly anti-inflammatory. They do actually contain dietary fiber. Flax has a little bit more dietary fiber. And fiber is one of the missing components in the American diet, so please get that in as much as possible. And then, you know, I use these a lot for smoothies, snacks. I even can sprinkle them on salads. I make them in desserts and entrees. Sometimes I'll make flax-crusted fish, you know, instead of using breadcrumbs, I might use flax, or I might use even hemp seeds. So I might use those when I cook too. So.
And do you grind them fresh, or how do you usually use them?
Flax you need to have grinded. You can't, or ground rather. You can't have them in the whole seed. Your body doesn't digest and work with them. Chia and hemp seeds, though, you can have them whole. They don't have to be in a powder, but flax needs to be in a powder. And I would certainly keep it in the fridge when you do grind it.
Great.
And then salt is your friend. A lot of people in America were afraid of fat, were afraid of salt, but nothing could be further from the truth that salt actually you need to live, to survive. You need it. And our adrenal glands keep us hydrated, so it's important that we understand that there are certain components that hydrate and replenish our adrenal glands, and salt is one of them. So I use a lot of unrefined Himalayan sea salt or Celtic sea salt, or really any salt that has color, although I guess now I'm seeing that one of this pictures does. It's some white salt, so disregard that. But salt should have color. It should be gray, pink, beige. It should have vibrant colors. And certain salts, like Himalayan sea sea salt has over 80 trace minerals, and those are minerals that we're just simply not getting in the American diet. The reason that we have our table salt is because it has iodine, and that was, that's something that most Americans, especially in the 1950s and 60s, were not getting. So the government pretty much stripped our salt and added iodine, and that is enough to prevent a goiter, but it's not going to prevent hypothyroidism. It's not going to prevent a complete deficiency in thyroid or in iodine, which we need for our thyroid gland. So, we can get our iodine from sea vegetables, which are easy to work with, and I use them a lot in my cooking, and of course from fish too. So,
and it's interesting because on the picture here, all of these things are salt. It looks like this is grapple or ground nuts or something like that, but it's actually salt.
Yeah.
And does it actually taste different than regular salt that people are used to eating?
It's definitely stronger in taste. That's a good question. It's stronger in taste, so I don't use as much. And so certain salts do have a different taste. I was in Hawaii this summer, and there was red salt, there was black salt, and some of them are used as more finishing salts. Not going to be used as much during cooking, but as the finishing salt. So certainly, they have different flavors, and they're strong.
Interesting. Try it.
Yeah, use them a lot. I use salt in everything. So if you want to take control of your health, and if you need help in just planning your diet and understanding how to make this not an enjoyable experience, food should be joyful, it should be creative, it should be fun, it should be something you look forward to, and for a lot of people, unfortunately, it's more of a burden, and it doesn't have to be that way. So I always offer people a free health consultation to really kind of break through and see where they need to go in their diet, and also in their lifestyle too, because that's a big part. So please contact me if you're interested. And thank you.
So we just really want to, first of all, thank Dr. DeNise and Elisa for being with us here today and explaining to us everything about adrenal fatigue and how to, what to watch for and what to expect of your doctor if you go in to get checked for adrenal fatigue, and then also what to eat to support your body if you know that you are adrenal fatigue or if you suspect that. So thank you very much, both of you. And at Patients Medical, we just really invite you to get on track with your health and revive your adrenal health too, obviously, is the topic. Even if you're far away from New York City and can't physically get here, there are lots of ways to connect with us. We have free events such as these webinars. If you are in the city, we do have free seminars. We usually have several a month. So go to www.patientsmedical.com/events. And I'm also going to show you another place that you can go. But our website, patientsmedical.com, is a very rich resource. If you are in the New York City area, I definitely invite you in either just to stop by and say hello and see this beautiful facility we have and all these fantastic doctors and practitioners we have on staff, but also to join us. Come by, make an appointment with one of our doctors. Take a tour of the facility, stay for one of our free seminars. Our doctors frequently give these seminars and many other events. I'm just going to run through the staff here really quick. Our medical director is Dr. Rashmi Gulati, our senior staff physician, and he also does holistic and Chinese medicine as well as stem cell therapy. This is Dr. Kokai. We have Dr. Stuart Wegg, our alternative pain management physician, Dr. Marcia Harris. She's a holistic gynecologist in internal medicine. And then, of course, Dr. Vivian DeNise, who is joining us here today, integrative internal medicine and pediatrics. Dr. Eileen DeFrancesco, psychopharmacology and psychiatrist. Dr. Gino Patino, he does holistic oncology as well as immunology. And Dr. Paul Dreshnik, he does plastic surgery, and he's also on our stem cell team. Dr. Eldiana Howard, holistic gynecology, and Dr. Victor I. Rosenberg, plastic surgery. We also have Dr. Ivan Mata now, a holistic ophthalmologist. I guess I'm going to have to redo this slide so I can make room for Dr. Mata on there next. And if you want to know more about these doctors, read their bios, check out the pictures, get a little bit more information on their specialties or their personal journeys towards being a health health practitioner, a wellness doctor, just go to their bios. You can click on Our Physicians on our home page, click on any of the doctors' names or the pictures, and then you'll be able to read all about them and their training, their expertise. You can also read more about us on our blog. So our doctors contribute to the blog regularly. It has a lot of really interesting information that's timely. So it could be seasonal, or if something came out in the news, you might be able to get more really relevant, pertinent information about your health and your family's well-being on our blog. You can also check out all of our different webinars and slide presentations on the resources page. So just from the home page, click on resources, and you'll be able to see everything that that we have recorded or posted on there recently, which is a great way to share and get the wellness information that you're looking for, or at least start your journey. And I also just invite you to get more information. So many of you probably have questions right now. Okay, perhaps you feel like you have adrenal fatigue. You realize that this is something that you need to work on, and you need a partner. So give us a call, and we'll be able to recommend one of our holistic medical doctors here who can partner with you to diagnose and treat your medical condition. And that's not just for adrenal fatigue, it's for any medical condition. Give us a call at 212-679-9667. We'll get you to the right place and help give you the information that you're looking for. Or if phone isn't the best mode for you, you can email us at media@patientsmedical.com. That's MEDIA @patientsmedical.com. We really look forward to hearing from you and help give you the information that you're looking for that will help balance your health and wellness so that you can feel like your very best you. So again, once again, thank you very much for joining us today, and we look forward to hearing from you soon.